Thank you. How many of you know at least one person who lives with a chronic condition or more? Okay, thank you. For those of you who did not raise your hand, well, now you know someone. My name is Dr. Katina Lang-Lindsey. I'm an assistant professor of social work, and I live with multiple conditions. No one with a chronic condition lives a life equal to those who do not live with a chronic condition. People with chronic condition, they work, they spend time with their families, they raise their children, while at the same time, they take medication, they attend their doctor's visits. Sometimes they go to the doctor multiple times a week. I call this the power of persistence. You see, I've worked several years working with people with chronic condition. A lot of my work surrounds improving the quality of life of those with chronic conditions. I work with people in a CKD clinic, what we call chronic kidney disease. And some of the patients that will come in, they were diagnosed with chronic kidney disease, and they may have been attending the clinic for many years or less. But one of the things I would talk to them about is, how do you manage your disease? And people will tell me, I manage my disease by monitoring my blood pressure, my diabetes, I exercise, I eat right. But guess what? Everyone had something different to say. No one person said the same thing. Also, I would ask them, how do you find meaning? And again, they would say, I find meaning spending time with my children, working a job, and all of the answers were different. Wouldn't it be different for you? That's what I thought. Because everyone find meaning differently. For me, I found meaning differently because my work with patients and the provider, I get to communicate with them. What are the concerns of a patient? But I also get a chance to talk to the provider, which is the doctor, on behalf of the patient. That's how I find meaning. Is there someone that you admired growing up? Well, there was someone that I admired. And I admired my grandmother. I admired my grandmother because she was a master craftswoman. She would make these beautiful quilts. And these quilts would be out of different shapes and size, or they would be cut out of triangles, circles. And what she would do is she would use these pieces of clothing from each family members to make these quilts sentimental in a way. But she would use these pieces, and she would put them inside of the quilt. But I would notice, and as I observed her, there were pieces of that quilt that she did not use. Matter of fact, there were pieces that she would put to the side because ultimately those pieces did not work. Because it was her discerning eye that would select pieces that fit. That's much like what people with chronic condition have to do. They have to pick the pieces that work, and the pieces that do not work, they put to the side. I've lived over 23 years, And I've had to cut out pieces that fit. What fit for the average person, it didn't always fit for me. So I had to find those pieces that fit. And I did. Let me share with you how I found those pieces. There are a few concepts that I want to share with you. Number one, the first thing that I have done is I've set boundaries. Boundaries are very important. Boundaries help you set limits. People set boundaries in all sorts of ways. But for me, I set boundaries by communicating with people what I can and cannot do. I also set boundaries by communicating with them times when I can, what I cannot. And I've also had to be brave and say no. Let my no be no, and let my yes be yes. The other thing that I do is I show gratitude. You know, gratitude means showing appreciation. I tell people, thank you. Because there have been a lot of people who have been very supportive to me in my journey. So I say thank you for the things that they've supported me on this journey. Number three, I serve. It is important that we serve others. I became a peer mentor, and I am a health coach. So I help people and I help them walk through, especially people with chronic condition. I help them walk through this process. But not only that, I educate them and I train them so that they can what? Pass it forward. Because it's important in this work that I train people, because that is the way you improve people's quality of life. The other thing I do is I surround myself with social support. Social support is so important when it comes to having people that support me in this journey of living with chronic condition. You need people, because when you attend multiple doctor visits and you take medication, you need your family, you need your friends, you need your healthcare provider. And for me, I've had so many healthcare providers. I've had organizations that was very supportive, like the National Kidney Foundation, AAKP, which is the American Association of Kidney Patients. They allow me to do research. And that research is used to support others. And last but not least, I live my life on purpose, which means I live my life intentionally and deliberately. I make sure there is a lot of joy and laughter in my life, because joy and laughter is what we need. Because it is important that we encourage one another, and everyone needs a cheerleader. But the other thing that I find to be very important for me is that, and it's rewarding, I have people that tell me that they live vicariously through me. That brings meaning for me, because they live vicariously, because I live vicariously through them as well. Because that is the power of persistence. So I want to leave with you a quote. The late Nelson Mandela said, "It's the glory of living lies not in not failing, but it is getting up every time you fall." And that is the power of persistence. Thank you.